Let's go down to Melbourne now and catch up with Liberal Senator Sarah Henderson, who joins us from Geelong, actually. Sarah, thanks for joining us again. It must be difficult for Victorians at the moment, but the crisis we're seeing unfold in the aged care system must be largely sheeted home to the federal government, your government, mustn't it, given that you do oversee it?
Chris, good afternoon. And yes, we do have a very serious situation in Victoria. Some 72 residential aged care facilities do have positive cases, and there are some where we have a very serious situation. The bottom line is, as the Prime Minister has made clear, Chris, we are working shoulder to shoulder with the Victorian Government. This is a shared responsibility. We are not interested in the blame game. We are not interested in having a fight, except the only fight that we need to have, which is against this virus, because we know that while Victoria suffers, all of Australia suffers. And so that's why our government is so focused on getting Victoria back on its feet and, of course, flattening this curve so that we don't continue to see these very high levels of community transmission.
Everyone, especially in politics, of course, is going to want to avoid a blame game, but you need to know exactly what's gone wrong at a federal and a state and a local level in order to fix it and prevent it happening elsewhere. It seems that there have been lapses federally and in the state system.
Well, Chris, there will be a time to investigate all of the things that have gone wrong. As you know, the Prime Minister has announced a federal inquiry into the hotel quarantine scandal. And I will say it obviously was a scandal what happened with hotel quarantine in Victoria.
Well, you'll need another one into aged care homes then.
Well, we always knew that if there was going to be high levels of community transmission, the most vulnerable people in our community across our state would be the most vulnerable in terms of catching this virus. So now what we are doing is working with the state, 1,400 ADF personnel on the ground, very substantial support for the aged care workers, making sure we're bringing nurses and other aged care workers in from interstate, and also replacing some workforces with ADF personnel. As the Prime Minister has said, Chris, it is whatever it takes. And that is only our focus at the moment and will continue to be our focus until we can get these numbers down and, of course, make sure that we can protect as many lives as possible and, of course, with our continuing focus on saving livelihoods as well.
South Australia has a plan in place whereby if there are any COVID infections in aged care facilities, those patients will be removed and taken to hospital. It hasn't really been tested in South Australia yet, but experience here and overseas suggests that might be the way to go, doesn't it?
Well, certainly these were issues which were raised by the Health Minister. There's been a lot of discussions between our government and the Victorian Government. We did raise concerns about making sure that anyone in aged care who needs hospitalisation gets into hospital straight away. And we've now got those assurances from the Victorian Government. That's absolutely imperative.
Now, does it worry you that all our policies at the moment, whether they're the border closures, whether they're the clamps and restrictions on business, whether it's the spending to get people through the shutdowns, that none of this is sustainable beyond a few months, and that in a year's time we might have spent all that money, done all this lockdown and still have to work out how to live with this virus?
Well, Chris, we have seen in most parts of the country an aggressive suppression strategy does work. We are seeing it work very successfully in every other state. I know New South Wales has got its challenges now, but of course Victoria, where there was that breakout as a result of hotel quarantine failures, we've now seen what happens when the plan, and that's the plan we had in conjunction with the states and territories, when the plan is not executed properly. So now what we need to do is focus on getting down the community transmission. Our aggressive suppression strategy is working, but insofar as the weeks and months ahead, we know that when we execute the plan properly, it does work, because we are absolutely anxious to open up the economy in Victoria. I am pleased to say that in regional Victoria, where I am based and represent, of course, we don't have the same restrictions as in Melbourne and the Mitchell Shire. And I'm also pleased to report, Chris, that in the Geelong region, we actually have no positive COVID case in any residential aged care facility. Now, that's a great achievement, but that could change very, very quickly. So it is absolutely imperative that people follow social distancing, hand hygiene, wear their masks when required. And of course, in Melbourne, we know that's mandatory now with limited exceptions.
You mentioned the economy.
Those things are incredibly important.
You mentioned the economy. Just quickly on that, we had CPI figures out today, and in the last quarter, our economy has shrunk by almost 2%. Well, the economy hasn't shrunk. The prices have gone backwards by almost 2%, 1.9%. The biggest drop, the biggest deflation over a quarter in this country for over 70 years. Here's what the Prime Minister, Scott Morrison, had to say about this today.
Inflation traditionally shows a level of activity in the economy, a letter of positive, in acceptable bounds of positive tension in the economy. And clearly, the impact of the pandemic, which has produced the COVID recession, is having a negative impact on our economy. I think everybody understands that.
Yeah, petrol prices down, rents down. Sarah Henderson, the good news out of this, I suppose, is for those people on fixed incomes, pensioners and the like.
Well, absolutely, Chris. And surprisingly, I have to say, I read a terrific story in the Geelong Advertiser today reporting record job advertisements in our region. So we are seeing some rays of hope in our local community and across Victoria. And of course, we know that without programs like JobKeeper, that's saved something like 700,000 jobs. So as the Prime Minister has made very clear, we will do what it takes to save lives and livelihoods, and that includes investing in families and businesses and in delivering that vital economic support that we need to get through this terrible pandemic.
Sarah Henderson, thanks for joining us.
Great to talk to you, Chris.